Hi there, and nice to meet you. My name is Dr. Steven Fong. I'm a medical consultant at East Sussex Healthcare NHS Trust, and today I'm going to give you my top 5 tips for interview practice over 5 minutes. I've been a medical consultant for a few years, and so throughout my training, I've had to go through many different interviews at FY1, core medical training, and consultant registrar interviews. So I do have the experience to tell you what I feel are my top 5 strategies to get the best out of your interview. The first thing is preparation. Prepare, prepare, prepare. One thing I always notice trainees is they underestimate the amount of preparation. They get the interview and they only start preparing maybe 2 or 3 weeks before. You have to understand that depending on the level of your interview, it could be one of the most important jobs in your career. So it's important actually that you dedicate the right amount of time of preparation. And if you do it slowly over a longer period of time, the more likely you will be more relaxed for it and able to manage it better. And when I say prepare, I mean about having a system for preparation. It's not just about buying the interview book. You want to get a good idea of what the interview style and structure is. You understand what the marking scheme is for your interview. For most interviews on the NHS jobs, you should have a marking or grading scheme to work on. You need to know what they're actually looking for. So most jobs will have a job selection criteria or job specification. You need to get a rough idea about where you're going and people, what they actually are looking for when they want to employ you. So prepare, prepare, prepare. Look up all the necessary information about that particular job you're applying for, including this grading scheme, and you'll be in a much better position to answer the questions. Know yourself well. One thing I notice about a lot of trainees, they think they know themselves, but they haven't really got to know all their achievements over the past few years. So what I would suggest is that you make sure that you look at your CV, make sure it's up to date, and make sure you remember very, very closely every single achievement you've had. Because once you really know yourself, you can pluck out those experiences, very quickly when you get asked that question in an interview. So my second top tip is to really get to know yourself by familiarizing yourself with your CV and your expectations and achievements. Use communication frameworks. This is one area where I think a lot of trainees don't do so well. Use systems to help structure your answers. For example, for a lot of background questions, we like to use CAMP, which stands for C is for clinical, A for academic, M for management, and P for personal. So by using these communication frameworks, you have a very systematic way of communicating all the necessary information to the interviewers. And also, just in case you get stressed or you get lost, you can still fall back onto this communication framework to carry on with your answers. There are other frameworks like SPICE, STAR. So what I would suggest is you familiarize yourself with a few sets of frameworks which you can easily get on the internet. My fourth tip is practice, practice, practice. So it's very easy for a lot of people to do a lot of reading but procrastinate and try to hold off the actual interview practice for as much as possible, partially because of fear and because for a lot of us we don't like to hear ourselves talking. But if you are going to succeed in this interview, the ones who succeed are more likely those who practiced a lot. And when I say practice, I mean ideally you find someone who's had the same kind of interview and knows the structure, and you practice face to face with them. If not, if you don't have someone like that, practice with your partner or family member. But as long as you have that physical and verbal communication, that helps improve your technique. And worst case scenario, bring out your laptop or mirror and practice to yourself so you can see all your facial expressions and how convincing you are at interview. So please do not leave this too late. Always practice, practice, practice actually the actual interview. So on the day itself, your nerves may be there, but there's an automatic response that helps get you through the interview. And lastly, don't forget to read a little bit about certain elements of leadership and management and NHS political issues. Sometimes with certain interviews, they like to pin people down on this. So having a good idea about the current NHS structure, how it works, and the different systems in play, particularly in the specialty you're applying, is very important. Also, learning to see whether you already have some leadership experience or management experience is a good thing. So if your interview is very far away, start thinking about, can I sit in on certain committees or get involved in management issues? So you got at least that real experience of it when you go to interview, because that will help a lot. So those are my top 5 tips. I hope that helps. I wish you good luck with your interviews, and see you at the other side.